friends, good evening. Once again, welcome back to my channel Mukambika Nursing. Friends, in the previous video, we discussed questions from fundamentals of nursing. Again, continuing same fundamentals of nursing questions. If it is useful for your studies, please share my videos to your friend circle. Also, subscribe my channel and support me. Let's start questions. Today's first question. The most abundant question in the extracellular fluid is options. Option A sodium, option B calcium, option C potassium, option D magnesium. Extracellular fluid consists of sodium. Option A is the correct answer. And the next question is the main intracellular question is option sodium, option B calcium, option C potassium, option D magnesium. Extracellular fluid consists of sodium and intracellular fluid consists of potassium. So here the answer is option C. And the next question is Hayes test is done for the detection of options. Option A acetone, option B bile salt, option C glucose, option D protein. Hayes test. Here we can see our different options. Benedict test for sugar, Rothras test for acetone, Hayes test, that is our question, test for bile salt, and Smith test for bile pigment. So here our correct answer is Hayes test is for bile salt. Option B is the correct answer. And the next question is appropriate size of rectal tube for giving enema for school age child is. Options. Option A number 22 to 24, option B number 16, option C number 12, option D number 8 to 10. Here the question is size of rectal tube for giving enema for school age children. Here we can see the size of rectal tube at different age group. For infant 10 to 12 French, for toddler 14 to 16 French, for school child 16 to 18 French. That is our question. And for adult 22 to 30 French. FR means French. So our question is rectal tube size for school age children. And the correct answer is it is option B 16 French. For school age children 14 to 16 French. Here 16 is there, so that is the correct answer. And the next question is for giving evacuant enema in children, the amount of solution should be. Options. Option A 500 to 1000 ml, option B 250 ml or less, option C 250 to 500 ml, option D 100 ml or less. Here our question is for giving enema, the amount of solution used in children. And the correct answer is it is option C 250 to 500 ml. For adult patient or adult client, it is about 500 to 1000 ml. Between 5 years to 12 years, it is 300 to 500 ml. So that is our question. That is school age children. It is 250 to 500 ml. So here the answer is option C. Our question is the enema given to destroy intestinal parasite is. Options. Option A cold enema, option B antihelminthic enema, option C carminative enema, option D purgative enema. Here our question is which type of enema is given to destroy intestinal parasite or intestinal worms. Here we can see the options. Antihelminthic enema, which is given to destroy intestinal worms. So that is our question. The enema which is given to destroy intestinal parasite or intestinal worms is antihelminthic enema. And the next option cold enema is given to reduce temperature. And carminative enema is given to relieve gaseous distension. Okay. And purgative enema is given to increase peristalsis. Okay. These are our options. So our question answer is option B antihelminthic enema. And the next question is the enema given to relieve inflammation is. Options. Option A astringent enema, option B cold enema, option C barium enema, option D anesthetic enema. Question enema given to relieve or reduce inflammation. Here we can see the options anesthetic enema which is given to induce anesthesia, astringent enema which is given to relieve inflammation. So that is our correct answer, astringent enema. And barium enema is given to diagnose a disease, and cold enema is given to decrease elevated body temperature. So our correct answer is option A, astringent enema, which is given to relieve inflammation. And the next question is, during giving enema, the distance to which tube is inserted in an adult is options. Option A 8 to 10 centimeter, option B 3 to 5 centimeter, option C 3 to 4 meter, option D 1 to 2 centimeter. Our question is, for giving enema, the distance to which tube, how much length the tube is inserted. In case of adult, 8 to 10 centimeter, inserted up to 8 to 10 centimeter, that is 3 to 4 inch. For children, we can insert the tube up to 2.5 to 4 centimeter, or if they are asking inch, means 1 to 1.5 inch. So here the correct answer is option A, 8 to 10 centimeter. And the next question is, during giving enema, the distance to which the tube is inserted in a child is options. Option A 3 to 4 inch, option B 3 to 4 meter, option C 2.5 to 4 centimeter, option D 1 to 2 centimeter. We already discussed for children's it is inserted up to 2.5 to 4 centimeters. So the correct answer is option C. And the next question is, when administering penicillin injection, the nurse observes a fine rash on the patient's skin. The immediate nursing action would be two options. Option A, administer the medication with CPM. Option B, administer the medication and notify the physician. Option C, withhold the medication and notify the physician. Option D, apply ice pack on rashes. Here our question is, a nurse is giving penicillin injection to the patient. While giving injection, she noticed that fine rashes are present on the patient's skin. What is the immediate nursing action? Or what she should do first? She should stop the medication or withhold the medication and inform this to the physician. Here the correct answer is option C. Withhold the medication and notify the physician. Move on to the next question. Administration of medication into the subarachnoid space is known as options. Option A intrathecal, option B intradermal, option C intraosseous, option D subcutaneous. Administration of medicine into the subarachnoid space or into the spinal cord is known as intraspinal or intrathecal. Option A is the correct answer. And second option, intradermal, means medications are given into the dermis or under the dermis. And option C, intraosseous, means into the bone marrow. Medications are given into the bone marrow. And subcutaneous means, or subcutaneous or hypodermic, means medications are given into the subcutaneous tissue. Here our correct answer is option A. And the next question is, name the nerve which is more likely to get injured in improper dorsogluteal IM injection. Options. Option A radial, option B brachial, option C sciatic, option D femoral. Improper dorsogluteal injection may lead to the injury to sciatic nerve. Option C is the correct answer. Move on to the next question. Method used while administering irritating medication via IM route is through. Options. Option A Z-track method, option B deep IM method, option C only push, option D all of the above. The medicine which can cause irritation to the skin is usually administered through IM injection via Z-track method. Option A is the correct answer. Move on to the next question. A nurse is preparing to provide phototherapy to a 4-day-old newborn who was admitted with hyperbilirubinemia. The nurse instructs the parents on how to care their baby while receiving phototherapy in the hospital. The nurse's teaching should include options. Option A, keeping the baby fully clothed to prevent hypothermia. Option B, covering the baby's eyes with eye shield to prevent retinal damage. Option C, decreasing the number of feeding for their baby to reduce number of soiled diapers. Option D, discontinuing the phototherapy if a mild skin rash develops. Here the question is, a nurse is going to give phototherapy for a 4-day-old newborn. The baby is having hyperbilirubinemia or increased serum bilirubin level. And the nurse is instructing their parents how to care their baby while on phototherapy. So what they should do is they should cover the baby's eyes with eye shield to prevent retinal damage. Option B is the correct answer. And the next question is, which among the following abbreviation indicate at bedtime? Options: option A OD, option B TDS, option C HS, option D BD. OD means once a day, TDS means thrice a day, HS means at bedtime. So that is the correct answer, option C. And the next question is, which among the following abbreviation indicate whenever required? Options: option A OD, option B TDS, option C BD, option D SOS. If required or whenever required is SOS. Option D is the correct answer. BD means 2 times or twice a day. Here the correct answer is option D, SOS. Friends, here again we discussed fundamentals of nursing questions. Surely these questions will helpful for your exam preparation.